So let me continue. K means clustering means nothing but similar data points are placed together. For example, grouping patients based on gene expression profiles likewise. Hierarchical clustering means it will create a tree-like structure of clusters. It will shows which data points are closely related. For example, clustering genes based on expression similarity. Then we have seen about PCA. It is like it reduces the large data into fewer yeah, anything, fewer important feature, like it will keeps maximum information with fewer variables. For example, reducing thousands of genes into some key components likewise. Then now we will see about autoencoders. So till this, if anyone have doubt, you may put it in chat box. I will clear it. Then we will move on to the next. If no doubt, you can mention that in chat box. We will move on to the next one. Okay, Harshita. Okay, now let's move on to the next. So, autoencoder. An autoencoder is also a type of an unsupervised neural network that learns to compress data and then reconstruct it back. Like first one is input, then it will move to the encoder, then it will make some compressed representation, then it will decode it, then it will gives you a reconstructed output. So it's like learning a smaller summary of your data while still keeping the important information. So an autoencoder is a neural network trying to reproduce its input at the output. So here the goal is it will learn a compressed representation of the input that retains important information. So, unlike principal component analysis, this autoencoder can learn nonlinear relationship. So, they can handle more complex data. So, how it works means first one is encoder. Okay, so here encoder will compresses the input into a smaller representation, which is called as latent space. So think of it as finding the essence of the data. Then it will compresses those input features into a smaller dimension. For example, if there is 20 lab test results, we will give this as a data. Okay, so it will compress them into three latent features. So latent means nothing but the compressed bottleneck representation. So it will contain only the most important information, which is small compressed representation of our data. So this forces the network to extract only the essential patterns. Next step is decoder. What this decoder will do means it will reconstruct the original input from the latent space. So it will tries to minimize reconstruction error and it will expand the latent space back to the original dimensions. Then if then the output will be the reconstruction one. So like if there will be some measurement, so it will measures the difference between original input and that reconstructed output. So it will tries to reproduce the original. So first thing is input, which is original data, for example 20 lab results. Then encoder will be there. This encoder will compress them into a latent space, and after that decoder will reconstruct them and it will give you the output reconstructed data. So the input and reconstructed data should be same, otherwise it will consider that there is some error in that data, so that there is some anomaly in that data, like why it will consider that data as something wrong. So we will see clearly about this. So there are three variants of autoencoder is there. First one is denoising autoencoder. So what it will do means there will be a noise or errors in the input data, and the network will learns to reconstruct the clean data. For example, input data is patient's lab test readings means, but some measurements are noisy or corrupted will be there in the data. So this denoising autoencoder cleans it up. So the output is accurate lab data. For an example, I will give you. Imagine a blurry MRI image. The network learned to produce a clear MRI image. So here the use of denoising autoencoder is noise reduction, image enhancement, and improving the data quality. And another model is sparse autoencoder. So the network is forced to use only a few active neurons in the latent space. So this highlights the most important features, and it will ignore some unnecessary information. For example, if you are going to give 20 lab tests, the sparse latent space only have the key indicators, like only three features